Cephalic vein drains into.
Axillary.
Basilic vein drains into.
Also axillary.
Yes.
Also axillary.
What happens to basilic vein?
Also drains into axillary, no? Also drains into axillary.
Yes. What happens to basilic vein? See, basilic vein goes deep into the arm. It joins with. It does not join with the axillary vein. It joins with venae commitants that come along with brachial artery and forms axillary vein. Clear?
Forms axillary, okay.
Understood? Basilic vein goes deep inside. Till here it is superficial in the middle of the arm. Then it pierces, goes deep inside. Then it forms union with venae commitants. All of you know what is venae commitants, right? What is venae commitants? Venae means vein. Clear? Committants means it is committed to go next to artery.
Arteries.
So small veins which run along the arteries, they are called as. Yes, louder. Venae commitants. So it joins with venae commitants and then it forms axillary vein. Understood?
Yes.
Okay. Which is the best vein for cardiac catheterization? If you want to pass any structure, any tube that straight goes to the heart, which one will you prefer and why?
Cephalic.
If you refer cephalic, you have to say why.
Drains directly into
Okay, it's more
axillary.
superficial. Next.
Directly continues into axillary.
If somebody says basilic, you have to say why. Alright, now remember cephalic vein goes all the way on the lateral side. Agree?
Yes.
It goes in a groove here called as deltopectoral groove.
He runs in that.
Yes or no?
Yes.
Then what happens to cephalic vein?
PSS clavipectoral fissure.
How does it drain into axillary vein? It goes here. Then what happens here after passing through the deltopectoral groove in the mid area of the clavicle, that is the midpoint of the clavicle,
PSS the
it
clavipectoral.
takes a turn. Clear? And then it pierces which fascia?
Clavipectoral fissure.
Clavipectoral fascia, and then it drains into axillary vein. Understood? So because it takes a turn, anything if you want to pass into the vein, it may not straight go into the axillary vein because there is a turn. So always basilic vein is preferred for catheterization because you pass into this, it will straight go into the axillary vein. Alright? Alright, this I told you.
Yes. Yes.
Nutrient artery to the humerus is a branch of axillary artery. All of you can see this, right?
Yes.
Yeah, I don't know how much good screening is from here to there. Yes. Anyway, don't worry too much. It is not a branch of axillary artery. Clear? It is a branch of profunda brachial artery. All of you know what is profunda brachial artery, right? It is the largest branch of brachial artery. So all the muscles of the arm are supplied by profunda brachial artery. So it's false. Axillary nerve supplies deltoid, right or wrong?
Yes.
The question says and it supplies one more muscle. So remember,
Teres
when I
minor.
ask you,
Teres
name
minor.
the
Teres
muscle
minor, teres
supplied
minor.
by axillary nerve, then you should always give two muscles to me. If you give one muscle, you will get only half a mark. What is the other muscle?
Teres minor.
Teres minor is supplied by this. Yes, from what we discussed today.
Lateral cord. The continuation of musculocutaneous. Musculocutaneous.
Which
No,
one?
lateral continuation of musculocutaneous.
Huh? Answer is D.
D,
Because
yeah.
remember that is forearm. Okay. So here we have musculocutaneous nerve. And remember, musculocutaneous nerve, after supplying all this, then only the musculocutaneous nerve will continue as forearm. Understood?
Yes.
It's not a direct branch from lateral cord of brachial plexus.
Posterior cord.
Yes, which one?
Lower subscapular.
Yes? Yes, the answer is very straightforward. It is lower subscapular nerve. Read the question loud.
Which of the following? Yeah, supraspinatus. Yes.
Which one?
Deltoid, deltoid. All the way
Say the
deltoid.
name of the muscle.
Supraspinatus.
Supraspinatus. You mark B. That is there. But now I want you to tell the name.
Deltoid and supraspinatus, yeah. Deltoid and supraspinatus, yes. Yeah. 90 degrees. Because a degree thing you cannot.
15 degrees.
Mm.
So actually this is 90 degrees and not 900. Huh? Yes, which muscle? That is 90
Yeah.
degrees. Huh? So from here to
Subscapular
here.
is external rotation.
Yes.
You know, abduction also got abduction and external rotation could have, but not by a lot.
Actually, it's a very simple question.
Yes.
All of you know the answer very well. But the only thing is you are still not thinking properly. By now you should have told the answer like this. You could have gone to the next question.
Deltoid and supraspinatus.
Yes, it
Yeah.
is deltoid and supraspinatus because first 15 degrees is already by
Supraspinatus.
right? And then deltoid is the most powerful abductor. So the answer is this.
A is axillary, B is radial, C is ulnar.
Yes. Say it loud, whoever told this answer.
A is axillary, B is radial, C is ulnar.
Yes. A is the surgical neck of humerus, so naturally axillary nerve has to be there. Alright, then B is the shaft of humerus. It is the radial nerve that is related there in the spiral groove. Then you have the medial epicondyle, that is C, where you have the ulnar nerve that is going behind.
Medial loop of tuberculous.
All of you know what is intertubercular sulcus, right? You have greater tubercle, you have lesser tubercle, in between you have a groove or a sulcus. Clear? So in the sulcus has got a medial border and a lateral border, which is called medial lip or lateral lip. So which is the muscle which is attached there?
I think pec major.
Is it medial lip or
teres.
lateral lip?
Either one. Teres or mine. It's one of the majors.
Yes. It is teres major. Lateral lip spectralis major. The groove or the sulcus, you have the insertion of
latissimus dorsi. Apex of cubital fossa is formed by brachioradialis and pronator teres.
Yes.
Brachioradialis and pronator teres.
Yes, brachioradialis and pronator teres. What does brachialis do? Is brachialis related to cubital fossa?
Yes, the floor.
Floor.
Yes, floor. If brachioradialis is the floor, what happens to supinator? Is it related to cubital fossa?
Yes.
Where?
Floor.
Floor as well.
Yes. Upper part of the floor is formed by brachialis. Lower part is
by
formed
supinator.
by supinator.
Bifurcation of brachial artery.
All of you know brachial artery, right? At one place,
Neck of
brachial
radius.
artery will divide into ulnar artery and radial artery.
Neck
So
of
you will know
radius. Neck of radius.
this. Yes. The
Yeah.
answer is neck of radius.
Upper tongue.
Okay, this one we discussed about. This
Lower
also
tongue.
we talked about.
Long thoracic is upper tongue. Roots, no, roots. Yeah, roots.
Yes,
C5,
this is
yeah.
roots.
From root straight it go down.
Greater tubercle of humerus. No. Greater tubercle, no. No, not sub. No. It should be. It's not ARB. It's not ARB because they will move into the neck of the humerus. Because they are rotator cuff.
Pack major.
Pec lung. I think pec major.
Pack major.
Very tough question, eh? Greater tubercle, only one muscle gets inserted. Sorry, lesser tubercle, it's asking greater tubercle, okay. Greater tubercle, how many muscles are inserted?
Subscapularis. Subscapularis.
3
is
muscles
answer.
are inserted. Lesser tubercle, only one muscle is inserted. Now, what are the muscles inserted into? What is the muscle inserted into the lesser tubercle? Okay, what are the 3 muscles inserted into the greater tubercle? They are called as SIT muscles. S-I-T, SIT muscles. Supraspinatus, infraspinatus, teres minor.
Subscapularis is lesser tubercle.
Which is the other muscle which forms along with these muscles? There is one more muscle forming rotator cuff.
Subscapularis.
Subscapularis. So subscapularis gets inserted into
Lesser tubercle.
tubercle. So in this choice here, in the greater tubercle, your answer is not subscapularis because it is into lesser tubercle. Latissimus dorsi is into the groove.
Pec major.
Alright? Pectoralis major into the lateral lip of the groove. So the only option left for you is infraspinatus.
Infraspinatus. Clavicle fractures.
What are the this is okay MCQ. I can ask a very simple question. I can keep the clavicle and ask you write the characteristics of clavicle. What will you write?
First ossified bone.
In OSP, I can keep a clavicle
Only
and I can ask you
horizontal bone.
identify the bone. Write 4 characteristics of the given
The-
bone. What will you write?
Enna bone? Enna type of bone? Sesamoid. It's also a sesamoid. Sesamoid na the. I don't remember. I remember.
Okay. It's the only long bone that is horizontal in the
Yes.
body. Next, 1 mark, yes. Next,
Sesamoid bone.
it is not a sesamoid bone. Yes.
First ossified bone.
Remember, it's a modified long bone. It's the only long bone that is horizontal in the body. It is entirely a subcutaneous bone. So from medial end to the lateral end, you can feel the clavicle. It's entirely a subcutaneous long bone. It is the first bone to start ossification. It is the only long bone that has got two primary centers of ossification. Remember this. Any long bone will have only one primary center and many secondary centers. But clavicle is the one that has got
two primary centers.
Two primary centers. Alright? Fine. Next. What are the two types of ossification you know?
Endochondral and
Endochondral ossification and
intramembranous.
membranous ossification. It is the only long bone that ossifies from membranous ossification. All other long bones ossify from endochondral ossification. Clear? Because it is ossified from membrane, cutaneous nerves can pierce through this bone. No nerves will pierce through a bone. So cutaneous nerve can pierce through the bone because it is membranous in ossification. So these are the characteristics of clavicle. Now answer this question.
So middle, because it's the most medial end of the bone.
Yes.
Medial end, no? Oh. Medial 2/3 and lateral 1/3. Yeah, whichever the furthest projection forward is. A.
Answer is A. Sure. Yes. Remember, the common site of fracture for clavicle is the junction between medial 2/3 and lateral 1/3. That is because if you have taken the clavicle and if you have studied properly, you will observe that the medial 2/3 of the clavicle is nice and round. If you take the lateral side which has got the acromial end, it is always flat. Have you seen this? So remember, the place where the tubular form changes into a more flat form, it is at that particular junction. So when you change from one form to another form in the same structure, that becomes the weakest point. Clear?
Yes.
Okay.
Scaphoid.
Yes, which is the largest
Scaphoid.
scaphoid bone? Scaphoid. Answer is absolutely wrong. Capitate is the largest bone. Clear? What are the two characteristics of capitate? One, it is the largest. What is the other importance of the bone? Yes. Yes, guys, what is this? I am not asking you a very tough question. This is a very, very simple question all of you should know. Next time I want you to get a stand and keep it. I don't want anyone to hold it, look at it. Everyone looks like Steven Spielberg. He is the only director whom I know I like very much, Steven Spielberg. That's why I keep telling his name again. Because when you hold the mobile phone, you won't concentrate on what is being told. Second, it gives you a false feeling that you have everything with you. Understood? these mobile devices have given a wrong impression to doctors that anytime they can refer. There is only one catch in this. Number one, with the patient in an emergency, you cannot use mobile phone to find out your diagnosis. Understood? Because when you click Google, he gives you more than 30-40 diagnoses for one symptom. Patient will come with 3 symptoms. That means you have to find out which the condition has got all the 3 symptoms. It's not possible. Understood? Second, when you are in the clinic or when you are in the ward, you have only limited time. Suppose you are working in the wards, they call you, there is an emergency to attend. You go there, you are left with maximum 5 minutes to decide what to do for the patient. In that 5 minutes, there will be relatives will be standing around, they will be watching. Suppose if it's a pediatric case, the mother will be holding the baby. You have to do something there at that time. So you cannot expect to open the mobile phones or tabs or iPad or whatever it is and try to make a diagnosis and find out the treatment. So there are common things which you should know. This 5 years is only for that. Understood? If you don't study properly during this 5 years, every day you go to the hospital, that is the time you start learning what you should have studied here. That is not possible. There the consultants will not have time to teach you. That's also true. They cannot take a lecture sitting like this for 35 minutes. So be very careful. We cannot go back and reset the time. But we can start now and give a better ending. So make sure you start now, because once you graduate, you will not have time to open your books at all. And you are expected to know everything. Everything in a sense, all the common things. Everything that is common, you should know. Alright. Scaphoid is not the largest bone, it is the capitate. Capitate is the largest bone. It is the centrally placed bone in the carpal bones. Clear? And it is also related to the axis of the upper limb. So the axis of the upper limb will exactly pass through the middle finger, capitate, middle of the forearm, middle of the arm like this. That's why you have the dermatomes divided on both the sides. Clear? So axis of the hand passes through capitate, and it's also the largest and centrally placed carpal bone. Scaphoid, maybe it might be the next largest bone. It is called so because it is boat shaped. It has got only one. It has got a one characteristics. What is that? Something related to its blood supply. Most commonly fractured carpal bone is scaphoid. First. Number 2. If you take a bone here, suppose this is the scaphoid bone, alright, the blood supplying the proximal part of the scaphoid bone always comes from the distal end. That is, the artery will first go on to the bone, it will take a turn, and then it will come and supply the proximal part. So if there is any fracture of clavicle, clear, the distal part will survive, the proximal part is affected. See, normally when a bone is broken, the distal part should get affected, right? But in scaphoid it's the reverse. Proximal part gets affected, distal part is saved because of blood supply. And the other important thing about scaphoid is, scaphoid forms the floor of anatomical snuff box. This all of you know. And anatomical snuff box is the place where you palpate to look for tenderness in case of, or tenderness means pain, in case of fracture scaphoid. So anatomical snuff box is not just a small area, it is the place where you have to palpate in case of injury to scaphoid. What is prefixed brachial plexus? What is post-fixed brachial plexus? Hey, these are all very simple questions. When I ask brachial, write or describe in detail brachial plexus, then you have to mention this. If you don't mention, then you don't get marks. You have to be very careful. Why? I tell you now. What is the root value for brachial plexus?
C5, C6,
C5,
C7,
6,
C8, T1.
C8 and
T1.
T1. These 5 form the brachial plexus. If some of the fibers come from C4, right, then it is called prefixed. If some nerve fibers come from T2 and join T1, then it is called
Postfix.
postfixed. If you don't mention this, I cannot give marks. Remember one more thing. When I ask you that question, describe in detail. Draw a diagram and describe in detail brachial plexus, and I give you 10 marks. Remember, the diagram carries only 1 mark or 2 marks maximum. All the other things that you have to write, minimum 10 points you have to write. 10 different points, then only I can give you marks. Got it? Now what are the things I would expect you to write? Suppose you are the teacher, you are setting a question like this, what will you expect me to write? Can you tell me? In my paper there is only one diagram and I say posterior cord, lateral cord, medial cord. How much marks will you give out of 10?
1.
Yes?
You only show the
But
corner
I have
1
drawn a
mark.
diagram and I have labeled all the branches,
Oh.
all the cords, all the trunk, everything I have labeled.
Okay, 5 sheet.
Below that there is only 3 words. Medial cord, lateral cord, posterior cord. How much will you give me out of 10?
5 to 6 lah.
No, since all of you are going to take the exam, you should know how a teacher corrects the paper also. You cannot command or you cannot say that I need the marks. No. There's something to this. How much will you give? But my diagram is very clean. Perfect labeling. How much will you give?
5 marks.
The beginning I
5
told you the marks for diagram is only 2 marks. I'll give you only 2 marks. What was asked next? Draw a neat labeled diagram and describe brachial plexus. Where is your description of brachial plexus? Clear? Yes, what will you say to describe brachial plexus?
Talk about
Yes.
roots.
How the trunks are formed, the divisions,
Okay, start from the
Roots.
trunks. Well, okay, if I ask you this question, what is the first sentence you will write after drawing a nice diagram? So 2 marks you have got. So 8 marks you have to get. What will you write next?
Brachial plexus
No.
is formed by 5 roots.
Before prefix and postfix, there is something else very, very important.
Root values,
Huh?
Samsung.
No root values.
I didn't get you.
Root values.
No. Root values, okay, if you write root values, okay, I'll give you 0.5 marks. So now only I have come to 2.5. See guys, see this is the problem, this is one of the problems with students thinking I have drawn a diagram, I should get marks. No. That's what I told you, my diagram is perfect, everything is correct. So 2 marks I give, because that's what